I don't know if y'all are aware, but news thing, hot news, breaking news. Coronavirus possibly in Jamaica. The minister going to speak shortly on the matter. You think I go live? Who am I go live? Just give me some message. Now waste my life, you know. See? Alright, look like it's about to go rolling now. Yes. You see the chief medical officer. Alright, so the minister there now. See? On. The minister just roll in. Stay tuned for the update. Somebody get me the headphone. Get me the headphone. The headphone for monitor the audio levels.
Where is Dr. Bruce not here? Headphone. Well, I'll change your address when he comes, he can see it. Okay.
Check the audio setup for me now. I hear him?
I'm not off now.
Yeah, in the room. As I said,
Okay,
breaking
thank you
news.
very much. Good afternoon, everyone. Let me just apologize for the delay in starting.
You're good, man. You're good.
All right, so let me welcome all of you.
You're good, man.
And I'm going to read from a statement, at which point we can deal with any questions that may flow from that. So, thank you for joining us this afternoon for what is an important development with the coronavirus disease 2019, or COVID-19 as it is referred to. Jamaica today confirmed its first imported case of coronavirus disease 2019, COVID-2019, here in Kingston. The patient is a Jamaican female who had traveled from the United Kingdom, which, as you know, has cases of COVID-19. She arrived in the island on March 4th, presented to the public health system on March 9th, and has been in isolation since then. Based on the patient's travel history and symptoms, health professionals suspected COVID-19 when she presented herself. A clinical sample was collected and sent to the National Influenza Center, where lab tests confirmed the diagnosis today at approximately 11 a.m. The patient and family members have been informed of the development. The patient's infection was travel-related based on the assessment. However, steps are being taken to prevent the risk of community spread. These measures include the dispatch of a health team to the home of the patient for assessment and initiation of public health measures, the identification and contact tracing for all possible exposed persons, meeting of ministry officials with members of staff at the hospital, and the necessary interventions that are required to be put in place. In addition, imposed travel restrictions remain in place. In fact, 3 countries have been added to the list of the 5 that were originally announced.